Tonight, we have been sharing stories of heartache, but also of hope as families and the experts combat the growing heroin epidemic. Highly addictive drug does not discriminate against race, gender, or socioeconomic status. And we now hear from a sister who is opening up after losing her brother to his addiction. Our own Elizabeth Saab has more.
My name is Heroin Epidemic. I was literally right where you are.
I really just couldn't believe that he had used again.
It's been exactly 5 months since Michelle Medoff's brother Jordan died of a heroin overdose just 1 month shy of his 24th birthday.
I actually got a call from my mom around, I want to say midnight. She had told me that Jordan overdosed.
For Michelle, who had been crowned Miss Long Island just 3 weeks before, the shock is still raw. She and her parents believe Jordan had kicked the habit after rehab.
Unfortunately, it was something that he kept so well under the radar that we just never were able to pick up on it.
Jordan's story is like so many here on Long Island. Over the past 2 years, there have been more than 100 heroin-related deaths, 78 in Nassau County alone. And experts agree the stakes couldn't be higher.
Dr. Stephen Margulies is with the Drug and Alcohol Treatment Center at the Phoenix House. He believes the addiction starts with prescription drugs.
People run out of money or really can't afford to buy the pills anymore. The next step is they're switching to heroin so they can maintain their habit.
There was no reason that he couldn't beat addiction other than that his was just so bad.
So bad for Jordan and other addicts on the island, but heroin knows no race or class.
The population that it's affecting the most now is the middle class to more affluent population.
People need to pay attention and treat it like the disease that it is, because it really is out of hand at this point.
This is going to be a full court press on the heroin epidemic.
Law enforcement officials say heroin arrests here are up 163% since the beginning of 2012. But the heroin keeps coming from mills like this one in the Bronx, shut down at the end of January.
It doesn't surprise me because it really is everywhere.
And in this case, it came to the Medoff family to take Jordan, a loss that Michelle says she'll feel for the rest of her life.
I can't imagine anything worse happening.
In Great Neck, Elizabeth Saab for RFL.
Any drug counselor or doctor will tell you that many teens and even preteens are experimenting with heroin. And the question tonight is, what should parents look out for? Well, I spoke with Lexington Center for Recovery drug counselor Catherine Valencia, and she says parents, they should speak openly with their kids about the danger of addiction. And she also says what any good parent already knows, and that is to not only keep a close eye on their children, but their friends as well.
In the last 5 years, it's, I can't even say quadrupled. I used to do intakes possibly 1 a week, and they would be opiate or heroin. Now we're doing 3 to 4 a day, which are heroin, which is a huge spike.
Can you put a human face on this, if you could, as to a case that came in that you learned later just ended in tragedy? You talked about 13-year-olds coming in, but a specific story that even stayed with you as a hardened professional.
Absolutely. A 23-year-old young man, clean cut, good family, was doing well in recovery, went out, and we found out that he died of an overdose. Left behind 2 young children, 2 young boys, his spouse, his mom, and he was, would you ever pick him out of a crowd as an addict? Absolutely not. Absolutely not. He could be our child.
You know, I was surprised when Senator Schumer called on the feds to step in, because he was talking about Dutchess County. And I know folks who may be watching us in the city say Dutchess County, and he called it a high-intensity drug trafficking area, and that the law enforcement officials, and we spoke to 2 such folks yesterday, said that they admit they're overwhelmed by this. And it's both the supply and obviously the demand.
Absolutely. Our methadone programs, which we have in Dutchess and in Rockland, are full to capacity. We offer a Suboxone program in Mount Kisco, which we just started, which is starting to build up also.
Is there a misperception about the grip that this drug can have?
Absolutely. I think people have a misconception about all the drugs. Addiction is a strong process. Heroin stands out a little bit more because it carries a high death rate.
talk about the challenges of trying to break the grips of it, because one of the things that surprised, even those that were close to Philip Seymour Hoffman was he was clean for 20 years from this. And we've heard from other addicts who say that, yes, even if you're clean for a while, the tug of this thing cannot be exaggerated. Talk about that and how hard it is to break, obviously, the command the drug can have.
Any addiction stays with you for life. It takes work to remain sober. You have to be involved in some kind of outside community, a program, treatment center, a church, something that helps you remain sober, because your brain remembers. Your brain remembers the feeling.
Give an idea to the audience, some of the comments. I'm sure the parents come in and they say, I wish I would have paid greater attention to X, or I wish I would have gone with my gut on Y. What are some of the things that if they had to do it over again, they would have done different? Children changing their friends and not being aware of it, not looking at it. And after it comes to light, they realize that they did see it, but they kind of ignored it. Most of them said just reaching out, calling somebody, call a center, because especially medication management and treatment at the same time, you have a pretty good shot. Without it. And you mentioned how the intake spike's gone up. You're seeing this in high schools? You mentioned 13. That's junior high school.
That's a younger one, yeah. The majority right now is young adult between 18 and, say, 25, 27.
And that's because of how cheap this drug has gotten, right?
Absolutely. They start with the pills and they can't afford it.
You know, sitting where you are and immediately to your right were two law enforcement. I figured when I said, what do we do about it? They would have focused entirely on, we've got to get in terms of the enforcement. We've got to get more cops in the street. They said, no, you got to get to these kids before they ever get to us. And when I said, well, should we rethink how we think about addiction? And they're like, yeah, it's an illness. And I was surprised to hear it from the guys, on the enforcement side. But you agree with them?
I do. I absolutely do. It's an illness maybe of the brain. This is just my opinion, not a medical thing, but what you see, it grips you and it doesn't let go. So if you can get before prevention and treatment when it starts.
What more do you folks in the front lines need? Is there enough resources here? You mentioned that you're at full intake right now. Is there bed shortage? Is there a number of professionals that you could use more help with, more hands to deal with this, more education on the front end? How do we fight this thing?
All of the above. What we're missing a lot of are MDs and psychiatrists. We need more to provide to be able to prescribe the medication, and more professionals. It's all a lack of people and money.
The Lexington Center for Recovery has a 24-hour helpline for those who need assistance battling drug addiction. And again, even if you're not an addict but a loved one is in trouble here, here's a few ways that you can reach out and get some information, let alone some help. You see the toll-free number there on your screen, 914-714-4892. And the government has a toll-free hotline themselves. And again, if you're looking for help with substance abuse, SAMHSA, or the Substance Abuse and Mental Health Administration, offers the hotline 24/7. It's free and confidential, and it gives treatment, referral, and information about mental and/or substance use disorders, prevention, and recovery in both English and in Spanish. And the number again there on your screen, 1-800-273-TALK. And again, that number, 1-800-273-8255. We'll be back with some final thoughts after this.